So it is important to handle patients in a very safe and respectful way. So, and that is why the WHO came up with World Patient Safety Day with a theme every year. They've had it in 2019, in 2020, and this year in 2021. A day where we will look at how we've been handling patients, okay? And in this group is not just the civil society group talking. I'm a doctor, I work in the hospital, and I'm interested in the safety of the patient as well. The midwives are interested in the safety of the patient. So all stakeholders in health come together once a year to say, how are we handling the safety and respect for our patients?
Now, I'm talking about the patient's Bill of Rights. You made mention of that. And then you said something, say in this part of the world, like there are so many people who are not aware there is any bill that existed like the Patient's Bill of Rights. Why is that so?
The information is out there. Because I think it was last year that the Vice President looked at so many things about patient safety in a conference where it's discussed. And the Patient Bill of Rights is there, and is even updated. WHO has done a lot of work. Patient Safety Africa has also done some work on that Bill of Rights. So the Bill of Rights is there for people to look, but unfortunately, our people don't actually search for these things. And some people know it, but in this part of the world, how do you apply the Bill of Rights when circumstances themselves in the hospital environment are not right? So there are some rights you may want to start claiming, and somebody will be like, okay, they claim right, Abi, all those kind of things. But when we're talking about patient safety, we talk both to the healthcare providers and the consumers of healthcare, so that everybody will meet at a good point. Nobody will think that patient safety is about fighting them. Let the healthcare professionals, my colleagues, not think that Patient Bill of Rights, patient safety is about fighting them. It is not a fight, because even the doctor can be a patient tomorrow. So it's about everybody being treated with respect.
All right, still talking about the rights, the Patient's Bill of Rights. Said in the Charter of Patients' Rights, there includes right to emergency care, which states that public and private hospitals have an obligation to provide emergency medical care, regardless of the patient's capacity to pay for the services. What effort are stakeholders in the health sectors making to ensure strict compliance?
Thank you. It's part of the efforts we're making. This is one of the efforts we're making to create awareness. For example, this year, the theme for this year's World Patient Safety Day is safe and respectful maternal and newborn care. Okay, so if a woman is brought from her home and rushed to the hospital because she just had a baby at home and she's bleeding, okay, maybe she had a tear, or whatever reason she's rushed to the hospital, whether she has money or no money, there is a law even in this country that within the first 24 hours of an emergency, money or no money, that person should be attended to. In fact, there is a fund that is supposed to be for that kind of thing. The person is supposed to be attended to within that first 24 hours. Because within 24 hours, majority of people should come out of that emergency state, so that they can even talk to you about how much are you people paying or not. So within 24 hours, do whatever you have to do to save that person.
Now talking about saving the person first and later money can come in. Like you rightly stated when we started this conversation, a lot of persons are not aware of these rights. I don't know if I have an emergency, I can walk into any hospital and then I get treated first and then later we're talking about it. So what are your team doing to ensure that patients are fully aware of these rights they are entitled to?
Thank you. So my team is Patient Safety Africa. And Patient Safety Africa, we want to establish a vigorous presence in Nigeria, for example, so that we carry our advocacy wide. And this is an opportunity for us to start talking. And we started by our leader, Dr. Sonny Isemede, started by a study that is going around the whole Africa. And the one we've done here, even in Abuja, in one of our facilities in Abuja, we scored not more than 32% in that study. And the study looks at parameters, because Patient Safety Africa want to use scientific proofs to look at how things are run, so that we can have an improvement. Because when you're looking at parameters, if you're improving, If you have 32%, when you are improving, you'll be seeing it climbing to 33, 34, and all that. So the study looks at, are you implementing this in your hospital? Are you doing this? Because if you don't have a pattern you are following, even in the patient safety, you will fail because there's no pattern.
All right, now talking about the theme for this year's World Patient Safety Day, it's about safety of safe maternity and newborn.
Yes, safe and respectful
maternity and newborn
care.
So can you talk a little more about the theme? Why that choice?
Yeah, in the course of this whole pandemic, there was a lockdown period, for example. It was difficult for people to get around, difficult for even women to go have their babies in hospitals, many factors. So because patient safety, World Patient Safety Day started in 2019, then 2020. So it was one of the best way to look at health is to first of all tackle maternal and newborn. So it was fitting to bring it in 2021, okay? Because by the time you see parameters like maternal mortality, which is very high in our society, increase, childhood mortality, under 5 mortality, increase, the figures improve in our society, then even we as Patient Safety Africa, we will know that we're having an impact.
All right, now, so talking still about the theme for this year's maternal and newborn. So how do you guarantee the safety of maternal and newborn? How do you guarantee that safety?
Yeah, thank you very much. Coming from the hospital where I work, I've worked in several hospitals, and I should be in a good position to talk about this, for example. There are some things we call 3 delays in maternal mortality. Okay. 3 delays that lead to, popularized by a certain Thaddeus that wrote about it. Now you look at delay in even deciding to seek for help, can lead to maternal mortality. Then second delay is delay in physically reaching the health facility that can help you. All the transportation delay, all the I don't have money for transport, all the I live in mountainous area, all the, Then the third one is the delay in the health facility itself. So in this Patient Safety Africa, our plan is to prevent and reduce that third delay. Okay? We'll continue to advocate for the other delays. When you do patient education, you help with the first delay. When you advocate with government, you help with the second delay. But then when you come into the hospital, the healthcare workers, the way the hospital is set up, we want to reduce that third delay. When somebody has come, the way you talk to them, the bureaucracy they have to follow to get card, to get lab result, to get seen, what we call cervicom in our own part of the world, all these cervicom processes, all these things have to be looked at.
So now, as a medical practitioner that you are, like you rightly stated, you're coming from the hospital, you work in the hospital, you've come across different characters, you've seen people. So now, how do you handle an aggressive patient or an aggressive relative of patients because you see them every day? How do you put yourself together to handle that and ensure their safety?
Okay, so unfortunately, in our part of the world as well, we have what I like to call the boomerang effect. This patient is coming from a place of, this time that I don't have money is when this health challenge is coming. So they are already going to the hospital late because they are waiting to see if money will come or if this thing will just improve or if prayer will take it away, and it's not happening. So they are coming, they don't have money. Most times when a man doesn't have money, he wants to use power to cover it. Now there are many factors, many societal factors on top of this person. So the person is coming unhappy. Now go to the other side of the health worker. The health worker is a product of the society too. Probably he has not paid his children's school fees or landlord's money, or he has not seen light in his house for days, or he has just done his shift, or he or she, and then you come and he's trying to tell you that please wait for your turn, and maybe he didn't even present it well, and you are coming with your own matter, you fire, he fires, so it's everything, boom. I call it a boomerang effect. So unfortunately, that is what we see. But what we advocate for, and what we will continue to advocate for going forward, is training and retraining. I studied medicine in school. That is for treating patients, sick body. But there has to be another training for interpersonal relationship that will help me calm my clients down to begin to treat. Okay? And that training has to continue. It's a continuous process. I take it today, I update the course next year or next 2 years. There has to be that training. You don't just, especially when people are going through the psychological effect of the nation or whatever you have, there has to be another training. The training may not be for the patient because the patient is the one seeking help. The training has to be for these health workers who are welcoming people from all walks of life. You have to be taught how to deal with this. So these are the way we would always advise that for patients to be handled better, doctors and nurses and all health workers need to improve upon their human relationship training. Do courses on that to be able to handle our patients better.
Now that will bring me to my very next question about mental health. Do you think the mental health or the state of a medical doctor will affect his responsibility, his relationship with the patient at the hospital in any way?
Of course, the mental state of anybody will affect the job they do, and that is why when doctors and health workers are calling for improvement in service, it might not be holistically understood. And when other societies are trying to improve the services, they know what they are doing. Because like we've talked about the doctor's psychological issues coming from wherever he's coming from, why wouldn't it affect his job? During the recent strike, people were arguing. Somebody said, these health workers are becoming insensitive. And somebody else in defense, they said, people are dying. Somebody else in defense said, you think before the strike that people have not been dying, that shouldn't die? A lot of people are dying that shouldn't die because things are not just right. Okay, now there are parts the government should do, but we, Patient Safety Africa, we're coming through the part we should do after signing the contract that I'm employed here. Okay, when two elephants fight, they say the grass suffer. We are trying to protect the grass.
Okay.
Patient Safety Africa, we're trying to protect the grass. So a doctor should quickly, it's funny that people may call in sick. If I'm a doctor, I call in sick in this part of the world, will tell you, why would you call in sick? Is it not hospital that you should be when you are sick? Come here, let's be sure that you are sick. I may come and not give my patient the best because I'm not in good condition. So the health worker's health should be taken very seriously. It was one of the themes in the previous World Patient Safety Day. The safety of the health worker for the sake of the safety of the patient too. You have to make sure the health worker is safe. Yes, to answer your question, yes, the state of mind of the health worker can drastically affect the patient. An example somebody gave me today is that someone saw a doctor in the afternoon in one of our hospitals. The doctor was so tired and saw the patient and wrote drugs for the patient. The patient went to the pharmacy and the pharmacist looked at it and smiled and said, please go back to the doctor. Just go back and show the doctor what he wrote. The patient complained, you people are pushing me up and down, and went back to the doctor and showed the doctor. The doctor said, did I write this? The patient was looking. The doctor said, if I wrote this, I'm really sorry. And tore the paper and wrote another prescription and gave. Out of tiredness, workload and all. Now, we thank God for the pharmacist that identified that, and the patient had to go back. And the humility the doctor had to accept that, I'm so sorry, and do this. So that is very important, to keep the health workers in good shape so that the patients will get the best.
Now, just like before we just call it a wrap, I would also want to know, as a medical practitioner, as a doctor that you are, and then there are so many other doctors there, and then you have your own issues, like you rightly stated earlier, you have your issues, you have things you're going through. So now, how do you ensure that these issues, these personal things you are handling, does not affect your day-to-day relationship with the patient at the hospital?
Thank you. It is one of the most difficult things we have to deal with as healthcare professionals, because There is something someone taught me when I was starting off cutting my teeth in this line of work. Okay, I go to the hospital in the morning. I try to, as I'm entering the gate, I park and I don't come out of my car immediately. I take a minute to change, not change my clothes, to key into work, leave home and key into work. And then I start work. And when I finish, I go home. I get into my house. I don't come out immediately. I'm trying to, because immediately I'm getting into my house, my children are like, hey, daddy, daddy. I have to switch off whatever may have annoyed me at work. And you have to be two different people every day. Okay, and you have to be trained to be able to manage that, not to let your home affect your work and not to let your work destroy your home at the same time. So, of course, we get this training as we were going through our training to become doctors. All these trainings, you'll be getting them. But to be sincere with you, it is never enough. You need to keep improving yourself. You need to talk to your seniors. When you think that it's getting to you, when you think that I'm losing it, when you think that I'm not able to handle this, you need to talk to somebody who is ahead of you in the profession, who has probably seen what you're seeing, to guide you through. And that is why there is leave. Once a year, you need to take a leave and go and refresh yourself and come back, And the Patient Safety Day, World Patient Safety Day, and for us in Patient Safety Africa, it is not just about the healthcare professionals. In fact, those who carry the matter should not really be the healthcare professionals. It's just like what people would say, that the lawmakers are taking so much money. They need to change this law about how much they are paid. How can somebody who is responsible for determining how much he is paid be the one to say, reduce my money? It's difficult to do that. So it's just like saying, health workers, check yourselves. We actually need civil society organizations. We need the public to look at the whole thing about patient safety, look at the Patient Bill of Rights, remind us of it. Okay? At the beginning, it might not sound palatable. It might look as if you're fighting. Don't make it a fight. Okay? And the healthcare professionals should understand, because your next neighbor, your friend, your father, your mother, anybody can be a patient.
Today is World Patient Safety Day. So what is the message in a nutshell? Like, what is the message? What should Nigeria look out for? What should Africa look out for from health workers going forward?
So, patient safety for this year, World Patient Safety Day 2021. Safe and respectful maternal and newborn care. We want our mothers to be respected. Some women complain that during their delivery, they were slapped by a midwife. Push, and you get a slap. Some will complain that they were insulted. Some will complain that the way they pull them and do all that in the labor ward or in the antenatal clinic and all that. No, we want safe, and respectful. Safe and respectful. Let women have their babies with the dignity of a woman. Okay? Let these babies that normally bring joy. Good enough thing, there's something we call amnesia that delivery causes. Once the baby comes out, the woman tends to forget the wahala that just happened before the baby came out. The cry of the baby brings joy, and that soothing feeling. But let's allow, we love pregnancy and childbearing is part of the world. We love it so much. So that thing we love so much, let's handle it with care. Make it beautiful. Organize it very well so that when a woman is carrying her baby, remembering all the whole processes of giving birth to that baby, including the love from the healthcare professionals, she will be proud to call herself a mother and not like, see what I went through, see how they suffered me. No, let's give dignity, respect, and help our mothers deliver safely and also have safe newborns.
All right, thank you very much, Dr. Alex, for coming on the program today. It's really, really an eye-opening for me, because before now, I never knew there was anything like patient right. I thought it was always about the health workers, but thank God, through Dr. Alex, at least we got to understand that there are patient rights, and if you get to the hospital, you should actually, know your rights, know what you are going for, and don't go fight the health workers who are there to help you. Thank you very much for coming on the program.
Thank you.